It wasn't long ago that mental health was still something misunderstood by medical professionals, and anyone showing even the slightest signs of mental illness could be locked away in an insane asylum. Many of the treatments used were little more than torture that often resulted in the death of patients, and the facilities were usually overcrowded and underfunded. With so much death and human misery focused in one place, it's no surprise that abandoned asylums have become haunted hotspots. Here is my choice for 5 of the creepiest haunted asylums with dark and disturbing backstories. Number 5. The Danvers Lunatic Asylum. The Danvers Lunatic Asylum was first opened in 1878 and was built on a secluded and isolated spot far away from prying eyes. It was originally designed to hold 500 patients, but by the 1930s over 2,000 people were crammed into the building. The asylum's imposing and creepy Gothic architecture is said to have been H.P. Lovecraft's inspiration for the Arkham Sanatorium, and it was also the setting for the horror film Session 9, as well as being in the video game Painkiller. Although the asylum was originally designed to be a modern and caring place for the mentally ill, the severe overcrowding and underfunding led to a disturbing decline in the level of care provided to patients. The building rapidly fell into disrepair, and the overwhelmed staff were no longer able to cope. Patients would often die in a remote area of the building and not be found until several days later, the smell of their decaying body betraying their location. As staff became more desperate to remain in control of the growing numbers of patients, draconian treatment methods were introduced, including straitjackets, electroshock therapy, solitary confinement, and perhaps most infamously of all, the lobotomy. Danvers Lunatic Asylum is known as the place where the lobotomy procedure was refined. Neurologist Walter Freeman pioneered this horrific treatment, which essentially involved inserting a long spike into the corner of a patient's eye and into the brain, where connection to the prefrontal lobe would be severed. While some patients did see improvements to their condition after being lobotomized, the majority suffered a wide range of terrible symptoms. Many died as a result of the surgery, but most were simply robbed of their personalities and mental functions, being reduced to nothing more than empty shells. Visitors to the asylum noticed that many patients were aimlessly roaming the halls of the building, or were just sat vacantly staring into space, broken by the cruel treatments they had endured within the walls of the asylum. With so many people living and dying in such terrible conditions over the years, there was a huge number of reports of ghostly goings-on within the asylum since its complete closure in 1992. The site became a popular location for adventurers and paranormal investigators, and many people reported seeing the ghosts of past patients lurking in the shadows of the asylum's many cells and corridors, as well as hearing screaming and wailing emanating from deep within the abandoned facility. Many of those brave enough to enter the asylum reported being overcome with a feeling of despair and the sense of being watched even though they were alone. The asylum has since been demolished, and condominiums were built on the site. However, the legend of Danvers lives on. Number 4. The Trans-Allegheny Lunatic Asylum. The Trans-Allegheny operated between 1864 and 1994. It was originally designed to hold 250 patients, but by the 1950s over 2,500 patients were held within its walls. Such massive levels of overcrowding led to a huge drop in conditions at the asylum, as staff struggled to cope with the overflowing patient population. What was supposed to be a facility for the treatment and care of people with mental illnesses had become a dumping ground for those deemed by society to be undesirable. People with such diverse conditions as epilepsy, alcoholism, and tuberculosis were locked away in the overcrowded asylum. When examining the reasons patients were admitted, a disturbing theme seems to be the prevalence with which innocent women could be sent to the asylum against their will. Many women were committed to the asylum for no good reason, and were often at the mercy of their husbands or male members of her family. Simply being abandoned by her husband, or giving birth to a child out of wedlock, was reason enough for a woman to be held within the walls of the asylum. As overcrowding increased, treatment of the patients became more barbaric, and electric shock therapy, cold bath treatments, and lobotomies were commonly used therapies. Patients would often be held in isolation, chained to the floor in cages, and the asylum became a notoriously dangerous place. In one particular incident, a man was hung by 2 other patients before being dragged while still alive into another room and having his skull crushed under a bedpost. Such killings were not uncommon, and even asylum employees were not safe, with many staff members being murdered over the years. Many people believe that all the death, suffering, and human misery that occurred within the asylum has left its mark on the building, and it's thought to be one of the most haunted locations in America. Common sights and sounds witnessed by visitors include screaming emanating from the electroshock therapy room, as well as seeing strange shadows moving through the building. The most haunted area of the building is the 4th floor, where the spirit of a Civil War soldier named Jacob is said to prowl the dark corridors at night. Other visitors reported being pushed against the wall by an invisible force, as well as seeing a dark figure who has since become known as the Creeper, crawling along the floor. The asylum was closed in 1994 and has since been purchased, and guided tours are now offered to the curious. You can even pay to spend the night at the abandoned asylum. However, I think even if you paid me, this is one place I would not want to spend the night. Number 3. Arradale Lunatic Asylum. First opened in 1867, Arradale was Australia's largest lunatic asylum and housed thousands of patients who, at the time, were described as the worst lunatics in the British Empire. The story of Arradale reflects the attitude towards mental health care that many governments had at the time. The mentally ill were cast away into asylums, and there was very little interest in caring for them or treating them. Cold and imposing insane asylums were seen as a cost-effective way of sweeping a country's mental health problems under the rug. Unfortunately for the patients, this attitude did not prevent the doctors from experimenting with all manner of barbaric and unproven treatments. Bleeding, electroshock therapy, and lobotomies were commonplace, and patients deemed unruly would find themselves strapped to chairs for hours on end, or imprisoned in isolation cages. Many of the patients were not even mentally ill. Asylum records indicate that even people with epilepsy, autism, or Down syndrome would be sent to Arradale, and what's even more disturbing is that it only required 2 professional signatures to have somebody committed to the asylum, but 8 were required for a discharge. This raises the likely possibility that many completely healthy people may have been sent to a lifetime of misery in Arradale for no reason other than that they made a powerful enemy or stood in someone's way. There are countless stories about women being committed to the asylum by their adulterous husband, as well as disabled children being imprisoned within its walls to spare the shame of the parents. With 8 signatures required for a discharge, the chances are that once you entered Arradale, you would never leave. With such terrible conditions inside, an average of 5 patients died every week, and this number would rise during the frequent outbreaks of deadly infectious diseases. A staggering 13,000 people died within the walls of the asylum during its 130 years of operation, and combined with the misery of the patient's existence, this has left its mark on the area, and Arradale is believed to be one of the most haunted places in Australia. Explorers of the abandoned asylum have reported seeing dark figures wandering the derelict corridors and witnessing nurses in white uniforms moving in the distance. Screaming, moaning, and footsteps are regularly heard emanating from deep within the building, and a strong smell is often reported. J Ward is believed to be the most haunted part of the asylum, and this is where the criminally insane were imprisoned. Numerous patients met violent deaths in J Ward, and it's been rumoured that if you peer through the cracks of one of the cell doors, you will sometimes see a pale face staring back at you. Although the asylum was closed in the 90s, it is still a popular location for urban explorers and paranormal investigators, but this is one place I definitely would not want to visit. Number 2. Poveglia Asylum. This island in Venice, Italy has a long and dark history, and it's first mentioned as far back as 421 AD, when people from the surrounding mainland fled to the island to escape barbarian invasions. During the devastating plague outbreaks of the medieval era, the island was used as a plague pit. Anyone showing signs of infection were isolated on the island to stem the spread of the disease. It's estimated that over 150,000 people died on this tiny island during that period. The enormous number of corpses were buried in giant, unmarked pits located all over the island. In fact, so many people have died here that legends say that 50% of the soil consists of human remains. In 1922, an insane asylum was built on the small island, where just like the forgotten plague victims hundreds of years earlier, those with mental illnesses were quarantined on the island and left to a grim fate. Shut away from the outside world, the asylum was believed to have been run by a cruel and evil doctor who tortured and killed many patients who were under his care. In his all-consuming desire to make a name for himself in the medical community, he became obsessed with finding a catch-all cure for mental illness, and performed a variety of sick and cruel experiments on his patients. Lobotomies were performed with basic tools like chisels and hammers, and his favourite spot for carrying out experiments was in the bell tower. His reign of terror is said to have ended when he fell from or was pushed from the bell tower. According to a nurse who worked at the asylum, the doctor survived the fall but was strangled by a white mist that emerged from the soil. Prior to his death, the doctor had spoke of seeing the spirits of plague victims during the night, and these constant sightings are believed to have made him suicidal. With such a bloody and cruel past, it's no wonder that the island is believed to be an extremely creepy and haunted place, and it regularly attracts ghost hunters and thrill seekers. Accounts of ghosts on the island first came from the actual patients at the asylum, and they often reported seeing the spirits of dead plague victims wandering the island, as well as being awoken by the wailing of the long dead during the dark of night. However, because the patients were considered mad, the hospital staff would simply ignore the terrified complaints of the patients. The body of the asylum doctor is believed to have been bricked up inside the bell tower where he carried out his experiments, and the bell is often heard tolling across the bay even though the island is now deserted. People who live in Venice avoid the island knowing full well its haunted reputation, and the island is officially off limits to all visitors. This has not stopped curious people from making their way to the island though, and there have been reports of mysterious noises in the night, footsteps, voices, and screaming. Some people even reported seeing the creepy figures of plague doctors with their long-nosed masks wandering the island at night, attending to the spirits of their long-dead patients. What makes this tale so strange is that there is little hard evidence of what took place at the asylum other than the word of mouth from local people, and many official records actively deny that an asylum even existed, but visitors who have illegally trespassed on the closed island have taken pictures which clearly show that the island was in fact used as an asylum. This has led to a strong feeling that a cover-up took place in order to keep the brutal goings-on at the asylum from reaching wider public attention. Number 1. The New Jersey State Lunatic Asylum. Founded in 1848, this was the first mental hospital in New Jersey, and was opened by Dorothea Dix, who was a firm advocate for the humane care of the mentally ill. The asylum was the first to employ the Kirkbride Plan, which promoted privacy, dignity, and a pleasant living environment as essential for all patients. Unfortunately, the New Jersey Asylum soon failed to live up to these lofty goals. In 1907, Dr. Henry Cotton was made medical director of the hospital. At first he seemed modern and forward-thinking, and instituted a number of directives to improve conditions for patients. However, he soon took a dark and bloody path. He became obsessed with the idea that all mental illnesses were caused by physical infections, and developed his own sickening treatments. He began operating on patients in an effort to remove parts of their body that he believed were infected and thus causing their mental problems. With his staff, he began removing the teeth, colons, testicles, ovaries, and even stomachs of patients under his care, even when no signs of infections were present. In most cases, this was done without the consent of the patient or the family, and the patient would often be dragged kicking and screaming against their will into the operating theatre. Dr. Cotton claimed a cure rate of 85%, but terrifyingly around 1/3 of all patients he operated on died as a result of his surgery. What is just as shocking is that his right to operate on his patients against their will was never seriously questioned. Dr. Cotton did not hide his activities and published numerous reports on his grisly operations, but his reports were kept quiet and he continued his bloody work right up until 1930. Eventually people began asking questions, and Dr. Cotton was forced to defend his actions. He subsequently suffered a mental breakdown, and in an attempt to self-medicate, he removed his own teeth, believing a tooth infection to be the cause of his own mental problems. Although the ruins of the asylum are strictly off-limits, those who have made it inside reported feeling hands touching them in the dark, witnessing shadowy figures, and having the disturbing feeling of constantly being watched. The abandoned asylum is thought to be haunted by the tortured souls of patients killed as a direct result of Dr. Cotton's invasive surgeries and amputations, and some people have even reported seeing Dr. Cotton himself, dressed and ready for surgery. Most of the sightings seem to occur around the lab and women's ward. The lab is where the doctor performed his work, and the women's ward is where he seized the majority of his subjects. People who have explored these areas have reported hearing screams and moans coming from the operating room, and seeing ghostly apparitions of patients with arms, legs, as well as other body parts missing. So that's my choice for 5 of the most haunted mental asylums. I hope you enjoyed the video, so let me know, given the opportunity, would you explore one of these abandoned asylums? I don't think I would be brave enough, but let me know if you would in the comments below.